This eye drop medication, Ocuflox Drops, is used to treat bacterial eye infections. It contains ofloxacin, which is a type of antibiotic that stops the growth of bacteria. It is important to note that this medication only treats bacterial eye infections and will not work for other types of eye infections. It is crucial to use this medication as directed and not to overuse it, as this can decrease its effectiveness. The recommended dosage and timing for using Ocuflox Drops should be followed as instructed by a healthcare professional. When using Ocuflox Drops, it's important to first wash your hands to avoid contamination. Avoid touching the dropper tip or letting it touch your eye or any other surface. If you wear contact lenses, do not use them while using this medicine. Sterilize contact lenses according to manufacturer's directions and check with your doctor before using them. To apply the drops, tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Hold the dropper directly over the eye and place one drop into the eye. Look downward and gently close your eyes for 1 to 2 minutes. Place one finger at the corner of your eye, near the nose, and apply gentle pressure to prevent the medication from draining out. Try not to blink and do not rub your eye. Repeat these steps for your other eye if directed, and if your dose is for more than one drop. Do not rinse the dropper. Replace the dropper cap after each use. If you are using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments to allow the eye drops to enter the eye. It's important to use this medication regularly to get the most benefit from it. Continue to use it for the full time prescribed, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Inform your doctor if your condition lasts or gets worse. When applying Ocuflox Drops, you may experience a temporary stinging or burning sensation in your eyes for a minute or two. You might also notice temporary blurred vision, eye discomfort, itching, redness, dryness, tearing, feeling as if something is in your eye, or sensitivity to light. If any of these effects last or get worse, it's important to notify your doctor or pharmacist promptly. It's important to remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Using this medication for prolonged or repeated periods may lead to a new fungal eye infection, so be sure to use it only for the prescribed amount of time. If you notice new or worsening symptoms, contact your doctor. Serious side effects may include eye pain or swelling of your eyelids or face, and in rare cases, a serious allergic reaction. If you experience a rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist for advice. Before using Ocuflox Drops, make sure to inform your doctor if you are allergic to ofloxacin or other quinolones. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, inform your doctor about your medical history, especially if you have other eye problems. After using this medication, your vision may become temporarily blurred or unstable. It's important not to drive, use machinery, or do any activities that require clear vision until you can do so safely. If you are pregnant, use this medication only if clearly needed and discuss the risks and benefits with your doctor. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Remember to use this medication as directed by your doctor and always follow their instructions. When using Ocuflox Drops, it is important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It is important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is important to follow your doctor's instructions and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Ocuflox Drops. If someone accidentally swallows Ocuflox Drops, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. U.S. residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. When using Ocuflox Drops, it is important to follow the dosage instructions provided by your doctor or pharmacist. Typically, the recommended dosage is 1 to 2 drops in the affected eyes every 2 to 4 hours. It is best to use the drops at evenly spaced intervals throughout the day for the maximum benefit. Be sure to wash your hands before and after using the drops and avoid touching the tip of the dropper to prevent contamination. If you wear contact lenses, remove them before using the drops and wait at least 15 minutes before reinserting them. If you have any concerns about the usage of Ocuflox Drops, consult with your healthcare provider for personalized advice. Remember not to share this medication with anyone else. This medication is specifically prescribed for your current condition, so make sure to dispose of any unused medication once your treatment is over. Do not hold on to it for future use unless instructed by your doctor. If you forget to use a dose, use it as soon as you remember. If it is close to the time of your next dose, then skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. Just continue with your usual dosing schedule. When using Ocuflox Drops, it is important to store them at room temperature. If the solution changes color, becomes cloudy, or develops particles, it should be discarded. It is crucial to keep all medications out of reach of children and pets. It is important to not flush medications down the toilet or pour them into a drain unless specifically instructed to do so. When the product is expired or no longer needed, it should be properly discarded. It is advisable to consult with a pharmacist or local waste disposal company for the correct way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.